Hi, everyone. My name is Colin Duggan. I'm CEO and co-founder of BG Networks.
Hey everybody, I'm Roman Lysek, a CTO co-founder. Glad to be back again.
This is our bi-weekly podcast on medical device cybersecurity, and we like to start with some news. And I think we have two news items today. One is, I think, for general cybersecurity, and this is a story that seemed to have been getting coverage recently. I saw it as an article in the Wall Street Journal, but Roman had just mentioned to me it happened a while ago. And this is about somebody who had all of his credentials stolen and ended up losing his job, and it's really impacted his life. Roman, can you give a little summary there?
Yeah, from what I recall about the issue is really downloading a seemingly free application which had malware, and that malware evaded the antivirus that he had on the computer, was able to start stealing credentials. I think they're generally calling these info stealers, where they're just on your system trying to steal all of your information, banking information, passwords, etc. Gives a third party access to your accounts, and then for this person, it snowballed from there.
Yeah, and I think the quick takeaways here are: be careful what you download. Make sure you have multi-factor authentication on your password manager, which he didn't have, and so they were able to just steal his password and then gain access to all of his passwords. And then sometimes the antivirus isn't foolproof and doesn't catch everything. So that's our first piece of news before we dive into kind of the FDA requirements for cybersecurity. What was the other news, Roman, that we have this week?
The other one is related specifically to a medical device. This is a SAMD in this case. It was another CISA alert that came out, I think about 1 week ago, which was the MedicSent DICOM viewer. So, DICOM viewer, it's basically looking at DICOM files. These are medical imaging standards. So it's a SAMD device. And the vulnerability that they found was the software had the ability built into it. You could tell it to check for software updates. And then it would contact the server to see if an update was available, and it would automatically download and install that update. The problem with that was they weren't authenticating the certificate correctly for the server. So you could have essentially a man-in-the-middle attack that's pretending to be that server. If the software automatically goes and initiates that contact, it wouldn't verify if it was real or not, and then it could download some unauthentic software update and install that instead. And so that's the recommendation there to avoid that for this particular case is don't rely upon the built-in feature in that DICOM viewer application. Download the update yourself from the manufacturer. So that's a way to make sure you have an authentic one in the meantime. But it kind of gets to the point of what we're talking about today around what are the threats that we really need to consider. And this is an example of one of those threats, which is someone trying to pretend to be you, so you're downloading unauthentic software updates.
Thanks, Roman. That's a great summary. And we'll dive in now to our continuing series of topics here for medical device cybersecurity that the FDA expects. What we've covered so far in this series is a introduction to requirements. What is a secure product development framework was another topic that we tackled. We talked about risk management, and today we're going to talk about threat modeling. And this is really a first step. And the beautiful thing about threat modeling is it gives you insight into the threats that you need to worry about. It's tightly coupled to risk management because the risks that ultimately you need to have security requirements for are based on the threats. And so they will naturally derive from the threats. And it's the basis of figuring out what security you actually need. So Roman, can you tell us a little bit about the process for threat modeling, and what the FDA is considering here. What are they expecting when it comes to threat modeling?
Yeah, I think the threat modeling there, in terms of what the FDA is looking for, I think it's a good way to think about it, since it really is when you're doing that first step is trying to figure out what are all the assets or items that you have within your system that you care about. Your patient data, your control algorithms, your software update process, your Bluetooth sensor that you need to authenticate and pair with. So you're trying to identify all the possible components of your system that there may be threats targeting each one of those. And then you'll start to think through, like, what kind of threats should I worry about for all of those components? And so the FDA has a nice categorization there. They listed off 6 things, 6 kind of areas you should look for threats. And they categorize it not by the asset types, but rather looking at stages of your development and things that go into it. So they're looking at things even including supply chain, your manufacturing process. How are you going to do that? Are there threats involved during manufacturing? Are there threats related to deployment? Are there threats related to interoperation? That might be with a Bluetooth sensor or your IT, your medical, your healthcare organization infrastructure. They care about threats to maintenance and updates. So that's what we just had, that example of a DICOM viewer. That's the update process. What is a threat against that? And even decommissioning. So what's a threat you should consider during decommissioning? So they have those 6 categories, and they really tie it back to looking at, it's not just any possible threats around security, but they specifically are looking for threats that lead to risks that could impact safety and effectiveness of your medical device.
Yeah, that's great, Roman. That's great. And the process that you use for your secure product development framework is not specified specifically by the FDA. In our approach, we use IEC 81001-5-1. And, outside of the first step, which is really developing competence, which is a general kind of skilling up of the organization, the next step is the threat model. And it comes right in the beginning, and it is specifically mentioned as part of that secure product development framework. There's a lot of different approaches you can use for threat modeling. The one that we use most commonly is STRIDE. Roman, do you mind taking us through STRIDE and talking a little bit about this? And why do we use it? Why is there this mnemonic of spoofing, tampering, information disclosure, non-repudiation, denial of service, and elevation of privilege?
Yeah, I mean, I think you hit. The nice thing about STRIDE is, like, those are the categories of threats you need to worry about. So the way STRIDE really ties it into is these categories of those threat scenarios. And why do what you want to do when you're looking at the threats is you can use that mnemonic to systematically look at your process and say, okay, this is an important component of my system, the software update process. Well, what am I worried about in the software update process? So am I worried about somebody tampering with my software update? Am I worried about, could somebody spoof my software update? So man in the middle, they could spoof being the authentic server, so you're downloading an inauthentic one. So it's a good way to kind of organize your thoughts around identifying those threat scenarios. Again, it's not the only one, but the reason I like STRIDE is because those are the categories you care about. And then you can think through, how do those apply to any of your processes, data, assets that you have in your system? And then from there, you can start to think about, okay, that's the threat. What are the realistic threats I need to worry about? So that's where you need the balance and the experience to figure out the right level. And then from there, you can start to think about, okay, how does that become a risk? And it's going to tie the whole process together.
Yeah, and as we use our process, we think about the assets. It's just the approach we use. You don't always have to do that. And then we think about, with those assets, those are things that could be affected by some kind of cybersecurity event. And like Roman was saying, it could be a software update. It could be data that's on a hard disk in a PC, for example. And we then think about how those things can be impacted. And what we see commonly, like Roman said, is tampering is certainly one that we check the box on quickly or often. I mean, when we're talking about different possible threats, because if you can tamper with something, you can affect the way the medical device actually operates. And then you are starting to look at, and we're going down the road a little bit here to risk, that there's some kind of safety impact. So anytime that code can be tampered with, that data can be tampered with, those are things you want to pay particular attention to when you're looking at the threats, because they ultimately can mean anomalous operation of the device and potentially leading to a safety issue. And that could even be for devices that are monitoring patients, because you may end up getting the wrong data. So Roman, any other examples of threats that come to mind for you?
Oh, many different threats. We won't go through them all, but you get into ones like denial of service is also a big one. This isn't necessarily just denial of service. I think a lot of times when you think about denial of service, you think about, oh, I've got a website and somebody does a DDoS attack against the website to shut that down. But you can have a denial of service against, let's say, vital signs monitoring devices in a hospital setting. So if you are able to systematically affect, let's say, do a ransomware attack against the vital signs monitoring in your system that leaves them completely unoperational, that's a denial of service, because now you can't use those devices anymore. And so again, that has an impact. I can't use the device. That's going to affect patient health and safety. And so you want to think about these categories. They have potentially broad meaning that may not just be sort of like a lot of people think denial of service is networking. That's not just it. It applies for other things. So that's another great example of being able to operationally stop the use of a particular device. And then a specific example of that, and I know we're getting into like what's an attack, but you could have, there are some devices we've seen where if you send a corrupted packet to the device, it reboots the device. So you can cause the device to end up in an operational loop that it just keeps rebooting and you can't use it.
Roman, any final thoughts for this topic of threat modeling?
I think for threat modeling, what I think is important to also, as you're doing threat modeling, so I know we go through a process, but as we piece together all the different pieces of the process, this one's going to tie directly into risk assessment, which we'll get into more detail on another podcast. But the reason it's important to start to think about that is that there's a lot of threats you could have. And you don't want to try to explore every possible threats, because some threats won't actually have any impacts on your system. And so you're trying to think of the threats that actually will lead to cybersecurity risks that do affect the safety of your device or its operational use. And so you're kind of leading yourself when you're doing the threat scenarios, thinking of, okay, this is probably going to lead to a potential concern that I have. I'm going to have to model that risk out there. But what I need to first understand the threat itself. So it's all going to cascade from there. And it's sometimes hard to decouple it. And I think that's why, as we go through the whole process, once you have all the pieces together, like they start to make a lot more sense.
Yeah, it's a great point, Roman. And it brings the thought to mind that as we help customers, work with customers, I can't remember a project where we were brought in the beginning. And I think people have a lot of times a good intuitive sense of the security that they actually need, and they start going ahead and start implementing security features. And I think it's like what you said here with the threats. You don't want to make an endless list of threats, and people have a good intuitive sense of what are the threats that matter. And the STRIDE process is really about making sure you don't miss any. So you might just kind of intuitively know already most of them, but you want to make sure there isn't something that might be a little bit more complicated. Configurations, key management can be tricky sometimes. Signing can be tricky sometimes that you might have missed. So the whole point of the threat model is to make sure it's comprehensive.
Exactly. And I think there's being asset driven, which is around what are the components of your system you care about, is great. Stride helps you think through all the separate components of the threats, the 6 different ones that you can think about against those systems. And then you should be thinking around those threats through the whole product lifestyle, right? So it's your manufacturing, it's your deployment, it's your decommissioning. Someone at the end of the day is going to decommission a device and it might end up on eBay. How do you make sure you have an efficient process to remove personal data, private data, keys from that device as part of a decommissioning process? So what are the threats against that you should consider as well? And that way you're making sure you're putting in the right level of security. You're not putting in more than you need, but you're putting in what you absolutely do need.
Well, that's great, Roman. I don't have anything else for today. Do you have anything else?
No, I think it's a good introduction for that. When we get into risk assessment, I think the pieces start to come together there. And I think that's what it's all about, is the risks and how to mitigate them.
Yeah, absolutely. Absolutely. And we're going to take on the topic of risk assessment in a couple of weeks. That's the next subject that we're going to be talking about. And by the way, a threat modeling document is one of the documents that the FDA requires for pre-market submission. It's one of the documents that needs to be attached to eStar when you're doing your submission. Well, thank you, everyone, and we'll see you in a couple of weeks.
Okay. Bye, everybody.